Hey, welcome. Today we're going to be talking about birth control pills. So doctor, can you tell us how exactly birth control pills work and whether it is safe for everybody to take birth control pills, and also a little about its side effects, please?
Well, birth control pills basically are a combination of estrogen and progesterone of different amounts, and how they act is that they prevent the egg from coming out from the ovary. So once the egg is not out, obviously your chances of pregnancy are very, very low. So they are probably the best type of contraceptive available. Basically, estrogen progesterone is already there in the woman's body, but these are synthetic estrogen progesterones. So they have effects very similar to what one would look at in, say, early pregnancy. So because in pregnancy, estrogen progesterone levels do go up in the body. So some women may have a lot of nausea, vomiting. For some women, they just feel very hungry. They have a little breast pain. Sometimes their skin clears up. That's why some people take oral contraceptives for acne. And sometimes they get dark patches on their skin, which is also part of pregnancy. But there are few risks for oral contraceptive pills. For example, slightly higher risk of breast cancer, and it also has a slightly higher risk of clots in the blood, which can cause problems for the woman. But an oral contraceptive pill is not a choice. It's something you take because you would rather not become pregnant and either end up with an unwanted baby or an abortion. Having a baby you don't want or having an abortion is much more physically, emotionally and psychologically damaging to a woman than having birth control pills.
Does taking birth control pills put a woman at the risk of cancer?
Only breast cancer. There's a higher risk of breast cancer, but what they have also found is that women who have taken oral contraceptive pills and who have breast cancer have lesser risk of dying, because on an average they'll be doing their checkups regularly. Whereas women who've never taken oral contraceptive pills or they have no history of breast cancer in their family don't bother to do regular checkups either, and so they end up finding out at much later stages. So it's a sort of catch-22 situation. People have taken it for 5 years, 10 years. Usually they say after 35 the risk of side effects is much more, and especially if a woman is smoking or she has diabetes or high blood pressure. But otherwise in young age groups is one of the safest ways of preventing a pregnancy. But it doesn't prevent HIV transmission and it doesn't prevent sexually transmitted diseases. For that is only condoms.